right, we are here day one of the aesthetic meeting in Vancouver. We have Dr. Karen Horton here with us, and we were just talking about this being a little bit of a homecoming for you.
It is, yes. I'm a Canadian, and I'm now in San Francisco. I'm from Toronto originally, so it's really nice to be back in Canada for the Aesthetic Society meeting.
I think this would be the first Aesthetic Society meeting that's been in Canada. Is that correct?
Actually, I don't know that. I think it may have been in Toronto once.
One more?
Yeah.
Awesome.
Might have been. But yeah, it's great to be here.
It's great.
And it's not raining yet.
I know.
Yeah.
Fingers crossed. And Dr. Horton, how long have you been practicing for?
18 years.
Okay.
Yeah.
So you've seen quite a bit of change within both the industry and this aesthetic meeting as a whole.
Definitely, yeah. And, like many plastic surgeons, I think my practice has evolved over the years. I started off doing a lot of reconstructive microsurgery. I did the deep flap, and so my meeting preferences have changed as well.
Okay.
I changed from going to mostly the microsurgery meeting and ASPS, now mostly to the Aesthetic Society and the women plastic surgery events.
And what is your focus through your practice now, you would say?
So I stopped taking insurance about 2 years ago. So now my practice is all self-pay, cosmetic surgery, breast and body, neck lifts, a lot of labiaplasties, and I still will do breast cancer reconstruction and a lot of complex breast revision surgeries, but they are not for insurance anymore.
Okay.
Yeah.
And do you take payments through Symplast and Symplast payments?
We do.
How's that experience been?
I haven't heard any complaints. I'm not involved with that side of my practice. I don't micromanage, but I think everyone's very happy with it.
Sure.
Yeah, and we started using Symplast just over 2 years ago.
Okay.
And I think anytime you take on a new program, it's a bit of an adjustment, but it's been great. I've been really happy with Symplast.
How was the onboarding and implementation experience?
So we worked with Nathan.
Yeah.
He came to the office and spent 2 days with us, and it was great. He was really easy to work with. I got some help making my own templates, looking at some other surgeons' templates, and of course I modified them. And I think, there's always an adjustment period. We were actually paper charts before.
Wow.
So for the first maybe 3-4 months, I still would use a paper chart and just scribble in it and then work on my notes. And it took about a year or so to really get the hang of doing electronic notes. But what I like most about Symplast is the photo gallery, having it all in one place, being able to take a picture with the iPad, show the patient right away, drawing on it. So I take all of my own preoperative photos and postoperative photos. I'll take the pictures, I'll show the patient, and then I'll draw on them and mark up the plan. If they have any particular, wishes, I'll be able to document it there. And then pulling up a comparison in their follow-up visits has been invaluable.
And do you utilize a lot of those before and after photos in your marketing?
100%. Yeah. I have a huge backlog because I had twins 13 years ago. And so from the time I became a mom, I'm still taking photos, but I haven't had a chance to go through them all.
Okay.
So I'm slowly getting through the backlog, going through cases, preparing before and after photos, and then always updating my website. I also have a before and afters Instagram account, which is dedicated just to before and after results. That requires a little bit more work because you have to cover up sensitive body parts.
Sure.
But it's really, really key in plastic surgery.
And is that a big driver of patient leads for you?
It is. And so I have 2 Instagram accounts. One is just Dr. Karen Horton, a day in the life of me. The other one is just before and afters. And I'm over 22,000 followers on my personal or my professional Instagram. My before and afters it's less than 2,000. Nobody comments ever. There's a couple of likes. But when patients come to see me, I always ask, how did you find me? They said, oh, your Instagram. I'm like, oh, did you see me skiing with my twins this weekend? They're like, oh, no, the before and afters one.
Right.
And they said, we've been following you for years, and we really like that you write the whole patient's story and the journey. And I'm like, thank you. That's great. I'm like, but you don't like anything. They're like, no, I don't want people to know I'm thinking about cosmetic surgery.
Right.
Yeah.
And it's something that we do every day in our lives, right? We look for that social proof in any service that we're thinking of or considering.
Yeah,
so
definitely.
to see that in person.
Yeah.
It's fantastic.
Yeah, so for me, Symplast has been a huge benefit, which is organizing the photos, making comparisons. Because before I had a digital camera and had to upload and put it in a file, and now it's really easy.
Great.
Yeah.
So obviously you came from paper charting to EHR, and that's a huge time saver in of itself. But is there any other features or anything that you utilize in the day-to-day that allows you to focus more on your patient-provider relationship versus sort of the menial tasks of the practice?
Well, I can't speak to the back office part of it. My patient coordinator, my biller can. But it's great to summarize what visits they've had, looking back on notes rather than flipping through and saying, how long ago was this patient's surgery? I just find it's really easy.
Awesome.
Yeah, and I'm able to chart. I kind of pre-chart before I see the patient. I'm all in talking to them. I'm not typing when I see them, but as long as I pre-populate the note, I'm done like 30 seconds later.
Amazing.
So I'm not charting until late at night. I'm not bringing my charts home with me.
But you could if you needed to.
I could if I needed to. And one other thing I really like, so I basically have 3 devices going at all times. I have the iPad, which I can bring with me to see the patient. I have the large screen, so I can look at photos. And then, of course, on my iPhone, it's great. Right. And so when I'm at a meeting like today, we had a question about a patient, and I can just pull it up on my phone and see it there. So
simple as that.
It's very easy.
And how is the patient communication? Are you leveraging secure messaging?
So I'm not doing the patient communication so much through Symplast. I'm rare in that I give patients my personal cell phone number. It is not abused. I find that really easy rather than going through Symplast. Of course, some patients don't want to, say they have a concern about a wound. Usually they text me. But for new patients, we invite them to send us photos ahead of time, just so we know what we're talking about. Or, using the video function, I still will do video consultations. So having them upload their personal body parts privately through Symplast is a huge plus. So I use it for that. But in terms of, daily communication with patients, I just have them text me.
Sure.
It's just easy.
And is there a track that you're looking most forward to this weekend at the Aesthetic Society meeting?
Well, I'm really happy that I'm not speaking this year, which is great because I'm usually on the podium and sharing what I have to say, and everyone's heard me speak already. So today, or this year, I just
get to sit back.
I get to listen.
Yeah.
So, of course, practice management is always of interest to me, even though we run a very tight ship and our patients, our patients are happy, our staff are happy, we have very little turnover in the office. There's always something you can learn.
Sure.
So looking forward to those. Of course, social media. I'm very involved with social media, but there's always, up and comers. I'm not the fresh face anymore. I've been in practice for a while, so I'm always learning from, the Gen Z and other generations. And then, of course, breast and body. And I'm looking forward to a couple of the face panels as well.
Started recording, you mentioned an initiative that you have or helping with later this year relative to women in aesthetics. Can you tell us a little bit about that?
Yeah, so I'm within the Aesthetic Society. I'm involved with the Women Aesthetic Surgeons Committee. I'm also chairing up the social media committee this year. And so for next year, we're really looking forward to going to Austin for our annual meeting. And we would love for Symplast to be involved with an outing. We usually have a half day. This year it was on Thursday. So yesterday, women aesthetic surgeons did a bike riding tour through Vancouver. It was great.
Wonderful.
We were off-site. And so, it could be a symposium. We could be speaking, but it would be really great to get out in Austin.
Yep.
So we would love for Symplast to be part of that. You could tell us a little bit about what's new with Symplast.
Of course.
And we can have fun in Austin with all the
Pretty
ladies.
amazing.
Sounds fantastic.
One thing that I wanted to go back to, we kept mentioning great relationship with your patients, and I had the chance to visit your practice actually a couple of times. Beautiful practice in the heart of San Francisco. I love the touch of the book that you keep.
Oh, yes.
With the beautiful, extremely beautiful notes from patients, thanking you for surgical procedures that you performed and how you changed their lives, and that was very emotional.
Well, thank you for that. Well, I collect thank you cards. It means a lot when a patient handwrites a card and either gives it to me or mails it. And so I had a huge collection, and I thought, well, let's make a scrapbook. So I have a very nice, wooden bound book, and they go back to my first year in practice in 2006. Of course, I've whited out the names, but it's really nice, especially for a new patient. They're nervous. They're often intimidated. They're thinking about having surgery. They've met me online, but they haven't met me in person yet. And to, go through that book and to read other patients' experiences, a lot of them were breast cancer patients, and how we help to change their life in a good way, and how grateful they are. It really puts new patients at ease. So thank you for that feedback. It's a very well worn book.
It was very...
You can't make that stuff up.
No,
No,
exactly.
it's real.
And I have to say, it's, like I said, very emotional because to your point, many of the ones that I got a chance to read, you changed their lives.
Yeah. Well, plastic surgery it's about restoring form and function, especially for cancer patients. In aesthetic surgery, it's about helping people feel comfortable in their skin, feel like their body, their face reflects how youthful and energetic they feel on the inside. And so we really can do a lot of good.
Dr. Horton, thank you so much for taking the time to stop with us and talk with us. This was truly a pleasure. Any last parting words for any of the listeners today?
If you're interested in learning about Symplast, I'm a huge advocate. It took me a while to find a company I wanted to work with. I looked at a couple other companies, and for me, it's been great. And so I'd be happy to speak to any other surgeons in person or by email or on the phone if they're interested in hearing about how it's helped me.
Oh, thank you so much.
Truly. Thank you again, Dr. Horton.
All right.
Awesome.
Have a great meeting.